Drowning is the third leading cause of unintentional injury-related death globally. According to the Makerere University School of Public Health, Uganda records an estimated 3,000 drowning deaths annually, translating to an average of 8 people per day. The most affected groups include children under 10 years, fishermen, lakeside communities, and people living or working around water bodies.
The age groups between 6 and 18, they die a lot on water.
Despite assumptions that non-swimmers are most at risk, Uganda Marine Police Force reveals that most victims are actually experienced swimmers and individuals familiar with water environments. This is attributed to complacence and overconfidence on water, lack of survival swimming skills, and failure to observe basic safety measures.
When people feel too much confidence that they understand the water, it has taken many of their lives.
There are also cases where victims drown while attempting to rescue others without proper rescue training.
If you check on the Templar, that very bad accident that took place on the Uganda waters, people died because they were trying to help others.
Some drowning incidents go unreported or are not officially recorded due to poor communication networks, fear of legal implications, and cultural practices surrounding the death. For example, cases such as drowning in swimming pools are often handled privately at home and never reported.
We have some local divers who can retrieve those bodies. So when they retrieve the body, they don't want to report to police. For about one reason is that they are saying it will take the process. The police will come, take to the post-mortem, cut, mortuary, what. They don't want to go through that.
Additionally, many bodies discovered on water are often classified as drowning without thorough forensic verification. A gap authorities say sometimes distorts the true scale of drowning in the country. To address this, the Uganda Marine Police Force plans to improve the accuracy of drowning statistics by developing forensic capacity to scientifically determine the exact cause of death for all bodies recovered from water. The initiative aims to ensure that every body retrieved from water undergoes proper forensic examination before conclusions are made.
We have not been in that line of, going to the nitty-gritties, maybe to dissect the body, doing the postmortem, to check on the lungs, to check on the what, to be certain that this is a drowning case. We've been taking all this as drowning.
Police believe this will not only improve data accuracy, but also strengthen investigation where foul play may be involved.
To develop capacity on water that we can do the forensics when we find a dead body, and this is what we are going to do anyway.
Nonetheless, Marine Police Force has a specialized team of trained mariners deployed across major water bodies. These officers undergo regular refresher trainings to enhance their rescue capabilities. However, officials admit that the force remains significantly understaffed given Uganda's vast network of lakes and rivers, including Lake Victoria and other inland water bodies.
We really need more manpower in terms of coverage. Because we have, I think, around 33 detaches all over the country. But if you have to look at the stretch of this lake itself, Lake Victoria, it's very big. And we have some areas where we don't have any coverage.
To bridge this gap, Marine Police has intensified community engagement programs, training local residents in basic water rescue skills, survival swimming techniques, and water safety practices.
We do community sensitization. We do community capacity building in the different skills. One, survival skills, because we must teach people how to survive themselves.
These efforts are complemented by public sensitization campaigns and CPR training sessions aimed at improving immediate response during drowning incidents. Despite these interventions, police acknowledge that even trained personnel are not immune. Several Marine Police Force officers have lost their lives in line of duty due to unpredictable water conditions.
They have set off from here to respond to emergency when the waves are too severe to come. Then from nowhere, weather changes and it becomes rough. And with the lake, weather can change within a minute.
Uganda is finalizing a 5-year national drowning prevention strategy spearheaded by the Ministry of Internal Affairs in collaboration with the Marine Police and other stakeholders. Once implemented, the strategy aims to reduce drowning death by at least 25% by 2030, strengthen emergency response systems, and improve prevention measures on water bodies. Key interventions include clear demarcation of water zones, installation of warning signage, including swimming instructors. Uganda will host the International Day for the Prevention of Drowning on 25th July 2026. A move expected to further spotlight the country's efforts in tackling drowning as authorities push for stronger systems and community involvement. Experts emphasize that accurate data, public awareness, and safety compliance remain critical in reversing what is increasingly becoming a silent but deadly public health crisis. Susan Naonga reporting for UBC TV.